Well, Doctor, you have your instructions.
Quite a young lady there.
I'll say.
Hi, Dix. Have I ever got one for you? Would you believe Cushing syndrome? The patient just came in.
Who's on it?
Dr. Alexander.
He can handle it. Suppose you and I have a little talk about Gus Williams.
Smoke inhalation? Dr. Brackett, do you realize that a doctor can be in private practice for years and never see a case of Cushing syndrome?
Well, your enthusiasm overwhelms me, Doctor. I just wish you'd show as much interest in the routine cases around here.
What do you mean?
Gus Williams, the smoke inhalation case, as you call it.
What about it?
Suppose I ask that question. What about him? What kind of a workup did you do?
The usual. Physical exam, chest x-ray, EKG, complete blood workup. It's a simple case of smoke inhalation.
Did you talk with his family? Any additional history?
It wasn't indicated. However, I did speak with him. He's an old man who's becoming senile.
Senile? Did they say it was chronic or occasional?
I didn't inquire that far.
According to the chart, the paramedics read a pretty slow heartbeat out in the field.
Yes, they were mistaken.
Were they? Or is it possible that in your hurry to see a rare case of Cushing's, you rushed through your EKG? You could have at least questioned the reading. The EKG shows a left axis deviation and a right bundle branch block. Right?
Yes.
Now, to continue your training, Doctor, that could be the start of a complete heart block.
Then the paramedics did read a slow heart rate.
And it should have jumped at you like a rattlesnake.
I thought they were wrong. In my examination, he appeared normal.
I'd guess that normality comes and goes. Which would indicate what to you, Doctor?
Occasional heart block, reduced blood flow to the brain, resulting in periods of confusion.
Senility, as his family puts it.
Makes sense.
Well, I'm glad you agree, Doctor. Now, should we see your rare case of Cushing's or Gus Williams' family?
Well, right now, Gus Williams needs our services a little more.
Just might make it yet, Doctor. One day.
So after the fire, I talked it over with Bill, and we decided to place Pop in a rest home.
It's not that we want to. We have to think of the kids. They could have been home when that fire started.
Are you sure it was your father's fault?
We're not placing any blame. But the investigator found a pipe. Pop's the only one who smokes a pipe. I'm sure he wouldn't even remember. Lately, he forgets everything.
We love him. We really do. But sometimes he can't even feed himself without making a mess. And then he doesn't even remember what he did.
The heart problem I told you we suspect. What if I said those periods of falling out could be corrected? Would you reconsider the rest home?
Can they be corrected, Doctor?
There's no guarantee, Mr. Williams. But it's very possible that it's related to his heart.
And if it isn't?
Then there's nothing lost. Regardless of senility, Gus's EKGs show every indication that total heart block could occur at any time.
A heart block.
Here, I'll show you what I mean. The heart is really no more than a pump. And to do its work, the heart muscles use electrical impulses produced by a special center, here, called the natural pacemaker. From this center, the impulses travel down a certain path along the muscle walls, causing the heart to contract and to pump blood. Now, in Gus's case, there's been a partial block somewhere along here, which causes his heart to slow down occasionally, meaning that the electrical impulses can't travel along the way they should. Now, eventually, anytime, in fact, he could suffer total heart block.
And there's something that can be done to prevent that?
Well, the answer is to take over the function of the natural pacemaker with an artificial pacemaker. It's a small unit like this that uses batteries to produce the impulses. The impulses flow through tiny wires that are placed into the heart.
How good are they?
They work very successfully.
And Pop's senility?
Well, it's only a maybe, but in my opinion, it should...
Any doctor, a code blue in the West Wing, room 209. Any doctor, a code blue.
That's Pop's room. What is it?
His heart